scanning the room. Callie's recording me. All right, and then that's just the MAR. We have some supplies. There you are. Okay, so to start, I will wash my hands. I'm going to look at my MAR. So I see Crisscross, date of birth August 7th, 1958, no known allergies. Crisscross needs 0.9% normal saline at 200 mLs per hour, IV continuous. That should be in the room. And they need metronidazole, 375 milligrams in 100 mLs of normal saline, IV piggyback. So I'm going to gather my supplies. All right, so I have my medication, my tubing, my gloves, and I am going to do my first check. So I have the right patient, Crisscross, date of birth August 7th, 1958, no known allergies. I have the 0.9% normal saline at 200 mLs per hour, IV continuous in the room. I will check that when I'm in the room. And I have the right drug, Flagyl or metronidazole, 375 milligrams in 100 mLs normal saline. It's right drug, right route, IV piggyback, every 8 hours, right time, and it's not expired. And so now I need to make sure that normal saline and the metronidazole are compatible. So I will check my drug card. And they are compatible, and I need to do the math. So it can be infused over 30 to 60 minutes, and I will do 60 minutes to be safe. So it's 100 mLs over 1 hour, so 100 mLs in 1 hour. All right, and so I have done my first check. I'm going to go to a quiet place to do my second check. All right. Got my supplies. I have the right patient, Crisscross, date of birth August 7th, 1958, no known allergies. They have 0.9% normal saline at 200 mLs per hour, IV continuous, should be in the room. And I have metronidazole, 375 milligrams in 100 mLs normal saline. It's the right drug, right dose, right route, IV piggyback, every 8 hours. And it is not expired. And so now I will make my way to my patient's room. Hello, my name is Candace. I'm a student nurse and I will be helping take care of you. The doctor has ordered metronidazole for you, which is an antibiotic, and you are going to receive 0.9% normal saline as well, so fluids. And I will do my third check. Or actually first I will confirm the patient. Can you tell me your name and date of birth? Crisscross, date of birth August 7th, 1958, and do you have any allergies? No known allergies. Okay, so now I will do my third check. I have the right patient, Crisscross, date of birth August 7th, 1958, no known allergies. I have the 0.9% normal saline at 200 mLs per hour, IV continuous. I've labeled the bag and the tubing with the time and date, and this is the drug, the date, time, and my initials. And I have the second medication, which is metronidazole, 375 milligrams in 100 mLs normal saline. It's right drug, right dose, right route, IV piggyback, every 8 hours. It's not expired. Okay. And so now that I have that, I am going to get the tubing ready. Actually, I will get the fluids running first. turn on the pump. New patient. And Guardrails IV fluid. This is 0.9% normal saline. And the rate is 200 mLs per hour. MLs per hour, volume to be infused. So it's not clamped, it should go. Stripping. All right, so now I will prepare my tubing. Maintaining sterility. I got my clip. And I have my two ends. And I would make sure this is clamped. So it should be, yep. Clamped. Okay. I want to label my tubing with the time and date and my initials. So it is and I'll label the medication. Metronidazole. It's 375 milligrams and 100 ml normal saline. Today is the 24th. Okay. Alright, my tubing is primed. And I need to hang the normal saline lower. So I have that. I need to wash my hands. I need to put on gloves. And I'm going to assess the IV site for any abnormalities, any phlebitis, infiltration, redness, warmth, and everything looks great. And I need to clean the port that I'm going to connect the secondary medication to. I'm going to do the port closest to the bag. This one. I'm going to clean it for 15 seconds and really scrub. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay. Now I will hook up my piggyback medication. And now it is ready to be back primed. I will do that by releasing the clamp and holding the piggyback lower. Fill it up halfway. Beautiful. Okay, so now everything's labeled, it's been back primed. Now I need to program a secondary medication. Secondary, let me get my mop. I have metronidazole. And I have 375 in 100 mLs. Next. And the duration is 60 minutes, as I confirmed from my drug card. I'll undo the clamp. Then you just wait for it to start infusing. All right, and so then I would take off my gloves, wash my hands, and document. And when the piggyback is done, I will switch the clips out so the metronidazole is hanging lower, put the normal saline back up, and that will start the infusion of the normal saline. And always wash your hands and document.